Hi, welcome. My name is Laurie Groh, and we have Amber Bouche with us. And Amber is new at the Glendale office. So thanks for being here today, Amber.
Yes, thank you, Laurie, for having me here.
So we're going to go over those typical questions people want to know when they're looking for a therapist. So first thing is, what's your general philosophy approach to helping? So example would be, are you more directive, guiding? How do you do therapy?
Yeah, I think that's a really important question for anyone to consider when looking for a therapist. I think my approach shifts depending on the client, but I always approach therapy from a person centered, strengths based position. And that helps me really understand what that client might need. So if that person responds better to like more guiding questions, less directive, or if that person, I've had people sit down and be like, I want you to call me out. I want you to be direct. And I'm also very comfortable doing that. So, a way I try to use that approach is to really talk with my client and see what they're looking for and what's going to be most effective for them. But another principle that really guides like the way I approach therapy is the saying where it's like be curious, not judgmental, right? So when clients bring things up and they might feel a certain type of way about that. Sometimes I'm bringing that in and I'm like, let's be curious about this. Let's not pass judgment on like what it means or how you're making meaning about this. And that can really also to help us have some of those conversations that are either guiding or more directive.
Yeah, I love that. I love that. A couple things with what you said just stand out to me, right? That's the big difference with doing that individual work. And the fact that you're able to ask somebody, what are those things that you might need in our relationship? Sometimes people never get asked that in their whole life, right? So that's an incredible thing to be doing. And then there's also that non-judgmental piece, right? And we could talk to whomever about something going on in our life, and there's going to be those judgments, good or bad, they're going to be there.
Hmm.
And to kind of set that aside really is helpful for that person to explore what they're doing in therapy, and also
Hmm.
just them to do that for themselves, which is so vital to just feeling good about ourselves. We don't have to feel like we're the best of the best at all times, but just
Hmm.
being curious of, hey, where did that come from? Let's go into that a little bit more is so incredibly helpful.
Yeah, I think that like lets people do the exploration work that's needed in some of those moments.
Yeah. And I think that's that important distinguished separation between just a friend and somebody that's actually there specifically for you to make the improvements in your life that you want, right?
Hmm.
So that's a strength. I already see that, but I'm going to ask you to tell me even more about your strengths as a therapist.
Yeah, I think, I've gotten some of that feedback from clients, what I just had mentioned about how I'm really open with them and asking like what they're looking for and what would be helpful. And I really can tailor my approach to that. A lot of people, kind of have difficulty finding a therapist that's a good fit. And so that's something I always ask, whether it's like your first time in therapy or you're trying things out with me, just to make sure that you're getting your money's worth and your time's worth, right? I don't want this to feel like it's adding more to your plate. I want it to feel like it's taking things off of your plate. And so really like approaching it that way with the client. I think another like strength of mine is that I have like a very open perspective to mental health. I've worked in a lot of different settings like inpatient, PHP, IOP outpatient, and now like private practice outpatient basis. And so just having like that picture of what the mental health world looks like, I think is really helpful when working through things on like an outpatient basis.
Totally agree, because that is something that I think the general public doesn't really know the ins and outs of all of the different types of mental health and what that looks like. And just even being able to tell somebody if they are going to a higher level of care of this is what
Mhm.
to expect, and having that experience, knowing that can help if somebody does end up needing to go into inpatient or more intensive type treatment, because
Mhm.
that does make a huge difference in somebody's willingness to go, right?
Right.
It's scary. It's scary to go to individual work,
Mhm.
sometimes for people, it's a big jump to say, I'm gonna go talk to somebody. So that brings me to the next question. What a lot of people are looking for is, what are the results? How do I
Mhm.
know things are getting better? And in therapy in general, that can be really difficult because we can't measure every single thing.
Right.
Some of those changes you might not know in this immediate behavioral change where everybody's like, wow, something's different, right?
Mhm.
But what could somebody expect as far as those expectations of, working with you?
Yeah, I think, like you mentioned, this is a difficult question because it really matters for each person what their goals are and what changes they're looking to make or what they're looking to process through. Because sometimes it's not necessarily like making a change, but it's working through an experience that you've had or something that's really impacted you. And so the results of that are going to look very different from people who are coming in like wanting to make a lot of changes. But with that being said, I like how you emphasize kind of the difference, right? There's like the subjective and the objective measures. Like we can kind of say, maybe if we do a certain assessment, like your anxiety is dropped from an 8 to a 5, right? But what does that mean for you objectively? And I think that is what really matters to me is what kind of changes are you seeing in your life that show you're making the progress you want to make. And again, I don't think there's like a great way to kind of put that into words, but some of the things I've seen with my clients, if we're working on anxiety, people are sleeping better, relationships have better boundaries, they're able to more easily communicate openly with partners, family members, children, some of those things. So I think, again, it really depends on the client, but sort of approaching it from objectively, like what they're wanting to see and trying to put that into words as we're working together to make some of those changes.
Yeah, exactly. Yeah, that well said, because that is so true. Where it might not be necessarily these outward changes that somebody's coming in for. It might be that there is a trauma that they're looking to process, or a difficulty that might not be observed by somebody, as
Mhm.
what they're trying to work through. And so having that conversation and that openness between you and the client is so important. And it's not just one session, right? One session of what
Mhm.
are the goals, and now we're done. It does evolve and change. Tell me a little bit about your specialties.
Yeah, so I specialize in working with adults who have a disability or chronic illness. So that is kind of a big category in and of itself, but I have dabbled with a bunch of different diagnoses and concerns. But something that I do there is work within like the intersection of mental and physical health. And I think that's something that is widely overlooked in treatment. And so by doing that, I'm able to help that individual kind of connect whatever physical thing they're managing with the impacts that that has on their mental health. And so, like I said, that can be, really anything. I've worked with like diabetes, Crohn's, ulcerative colitis, Ehlers-Danlos syndrome, people who are in remission from cancer. Like it's kind of all across the board.
And then there can be that big component of it is that silent suffering. Um, and then what that really does to us. I think that getting that support is huge.
Yeah, I think, something you're touching on is that period in chronic illness where you can kind of go into a flare and then go into remission. And sometimes it's hard to know the exact like timeline on that. It could be quick, it could be long periods. Like you might be in remission for a year and then have a flare pop up. And that is really hard to manage when you think about like your mental health or health anxiety or depression, right? If in your flare, like symptoms are so intense that you lose the ability to do the things you normally do. And so I think that's also where it's really important to have like some consistency in mental health care and have that established for yourself so that even when things are going well, like you're still kind of checking in with that part and managing your health and your mental health so that you can maybe find a more consistent spot for yourself within those ups and downs.
And that advocacy for yourself too, right? That's an important component of the long-term chronic health issues, right? That can be also extremely frustrating for people where they're, not getting answers, or They're getting information from one person to the next, and that there's not really that effort of communication, right? And being
Mhm.
able to have that background for yourself of knowing, okay, this is a common thing in this particular illness. This is something to just maybe talk about, or don't forget, hey, let's write this all down. Let's talk to the doctor about it. Let's get a better plan in place can be a game changer for somebody. For me, for those out there that are kind of wondering, what is that actually like when you have like a chronic illness, right? Now, not everybody has been pregnant, but I think about it like there's a similarity to that first trimester where you're not telling anybody,
Mhm.
but you're exhausted, you're puking, you can barely get up. There's all of these things and you can't tell anybody yet, you know?
Mhm.
For those of you that might want to kind of get a little bit more understanding of what that feeling is like, where people are
Mhm.
asking the same of you, but they don't know that there's a flare up. They don't know that there's more going on. So helping people navigate that,
Mhm.
so crucial.
Yeah, I like that image too, because I think a lot of times, like bringing in your supports, right? The person who is in their first trimester, likely the only other person who knows is their partner.
Mm,
And typically that person is not pregnant, right? So they're not experiencing what that person is going through. And so they're really trying to like explain that to them. And I think we can also connect that with the chronic illness population. Like these people have their supports if they're willing to open up to them. But those people don't know like what it actually feels like to
right,
live what that person is experiencing. And sometimes these individuals can get really burnt out, like trying to tell other people what it's like and what's going on for them. And so I think this space also offers the ability to be able to talk about those things and kind of manage some of that burnout because with the work I've done, there is I'm not gonna understand your exact position, but there is a different level of understanding there.
right, exactly right. Yeah, we can never know, right? We can never know what somebody else is experiencing, but to be able to talk through it and so that they can also maybe explain it too in a different way that isn't
Mhm,
so so draining.
mhm.
So, I want to hear a little bit about why you decided to become a therapist. Is
Yeah.
that was the question?
Yeah, that is always a question. I think, as I just talked about this specialty, it's been really motivating for me. I feel like I found a very meaningful place in the therapy world working with this population. And I got into that because I saw the gap. So I think, a lot of times therapists have like a lived experience that can motivate them to work with a certain type of population. And that was the case for me. And so seeing this need, and wanting to fill some of that has helped kind of propel me to work with this group of people and really hone in on some of those skills.
Yeah, and it brings this additional connection to the work, right? Where
Mhm.
it yeah, the more meaning we have in our work and in our lives, the better we're feeling, right? And the better that our clients are feeling. So I truly believe in that relationship with it. So, is there anything I missed today that you would want to mention or talk about?
I think just like in addition to this group, I also work with like adults, as most therapists do, like anxiety, depression, trauma. So I just want to throw that in there. Like, this isn't the only thing I see. So if you do think, kind of based on what I've shared, that we'd be a good fit, please feel free to reach out, even if you're not like a part of that population.
Right, right. Yes, thank you for sharing that.
Yeah.
And if someone wants to reach out to you, they can go to our site, right, and
Hmm.
email you directly, or they can reach out to our main line, and Katie will walk through that process with them. Thank you so much, Amber, for your time.
Yeah. Thank you.
All right, and we'll talk soon.
Yep. See ya.
Bye.